anti-PD-1 related pneumonitis during cancer immunotherapy. Definition: the use of antibodies against programmed cells PD-1 which block inhibitory T-cell checkpoints is a promising new therapy for advanced cancers. Recent trials have shown substantial clinical activity of anti-PD-1 antibodies in advanced cancers and led to the approvals of these agents, including pembrolizumab for melanoma and nivolumab for melanoma and squamous cell lung cells. Immunotherapy application on medicine. Immunotherapy is based on the UN simple concept. There are a number of checkpoints in the immune system that are inhibitory pathways that cushion or block the immune response. These paragraph immune therapies are designed to block or inhibit these inhibitory pathways. For example, one of these inhibitory pathways, PD-1, causes disinhibition of a type of immune cells called T, allowing attack and kill cancer cells. Two of the articles in Nature, directed by Thomas Powles and Roe Herbst, present the result of the first phase of clinical trials with an antibody that blocks ligand PD-L1. The group Powles, Queen Mary University of London. The simple treatment is effective in patients with metastatic bladder cancer, the type of tumor UN who have not been major advances in treatment in past 30 years. A video about this disease.
From Bavarian Nordic and Dendrion.
Throughout our lives, the cells in our body grow and divide. But when cells start dividing and spreading uncontrollably, they become cancerous. There are more than 200 different types of cancer, and scientists are continually developing and testing new ways to treat them. Most cancer therapies involve drugs designed to kill the rapidly dividing cells. This is what chemotherapy does. But there is a different approach called immunotherapy. Immunotherapy uses the body's own immune system to fight cancer. This involves activating immune cells and getting them to recognize the cancer tissue as different from normal body cells. This isn't easy, but recently the field has had some success. The FDA has approved several new drugs, and with more drugs in clinical trials, some say we are entering a new era of anti-cancer immunotherapy. The idea goes back to the late 19th century, to an American surgeon named William Coley. He injected bacteria into tumours and watched them shrink. The bacteria, it seemed, were provoking an immune response. But our immune system is highly complex, and for most of the 20th century, scientists struggled to turn Coley's observations into effective cancer treatments. But after decades of learning about the immune system, a variety of immunotherapies are finally making their way to the clinic.
Well, continue. The pros. The investigational anti-PD-1 immunotherapy shows clinical activity in a phase 1 of previously treated patients with cancer non-small cell lungs, metastatic melanoma and renal cell cancer. The clinical activity of anti-PD-1 was published in the New England Journal of Medicine and presented at the 14th annual meeting for the American Society of Clinical Oncology. Development programs anti-PD-1 registration, NSCLC and RCC for this year begin. The metastatic melanoma begins one final episodes of 212 or early 213. The cons. As we can see, biological agents, also known as immunotherapy, as a new alternative for the treatment of cancer, Where to look you can see the advantages they have over conventional methods, radiotherapy or chemotherapy, but it also presents some disadvantages. For example, it depends on the expression of membrane receptors to be effective, but this happens in the most cancer, and in only a small percentage this absence is observed. So, in my opinion, it is a matter of time before such therapies take strong enough to stop being secondary and move to the first line. Another video about cancer immunotherapy.
This video tutorial will be talking about cancer immunotherapy. Now we have studied cancer because cancer is not a study small details of cancer, how cancer cells proliferate and their properties and the genes that are related to cancer. And what we have studied and what we have learned is that cancer cells are creating a war, molecular war between the cancer cell and the immune response of host. For example, if we take host as a human being, then our immune system will always try to protect our cells against cancer cells, right? So it's a war between cancer cell and our immune system. So one approach can be used to treat cancer is to augment or supplement our natural defense mechanisms with our own immune system. This is the basic behind the cancer immunotherapy, is that if we develop our immune system, if we make our immune system much more strong, and if we instigate our...
Well, it happened in Ecuador. In a recent phase 1 clinical trial, a novel antibody treatment causes tumor regression but as disease stabilization in patients with a variety of advanced cancers. In this multicenter trial, patients who had exhibited disease progression after a standard systemic therapy for advanced or metastatic cancer were treated with an antibody against the protein ligand programmed DIT1 PD-1. The monoclonal anti-PD-1 was administered as an intravenous infusion every 14 days in 6-week cycles for a maximum of 16 cycles. The new antibody produced complete or partial tumor response in 17 of 135 evaluated patients. Finally, the conclusion are the clinical oncology community has rapidly expanded access to the variety of immunotherapeutic agents for the treatment of several types of cancers. Thus, knowledge of the spectrum of manifestation of autoimmune pneumonitis may assist other clinicians in managing these rare but potentially serious toxic effects. Taken together, these results indicate that the anti-PD-1 antibody may be safe and useful against a variety of advanced cancer immunotherapy. A new phase 1 trial underway at MD Anderson Cancer Center at the University of Texas and other institutions is enrolling patients with refractory breast cancer and gastric cancer in addition to those with the cancers treated in this study. Thank you for your attention.